Medicare Advantage plans are going through a shift this Medicare open enrollment period, and it's taking a lot of Medicare beneficiaries by surprise in benefit changes and plan cancellations for 2026. I'm going to walk through exactly with you what is changing, why it's changing, and what you need to know if you might be on a Medicare Advantage plan or thinking about one this open season. Hi, I'm Christian Brindle. I run a company called Everything Senior Insurance, formerly known as Christian Brindle Insurance Services, and we are a nationally recognized top Medicare organization that helps Medicare beneficiaries with their plans and navigating through the weeds to find their best option based on their needs and preferences. Everything under the sun, we eat, sleep, and breathe Medicare, whether it be Medicare Advantage, Medicare Supplement, Medicare Part D. So let's talk about Medicare Advantage this open season and what is changing. So last open enrollment period, not in every area, but in a whole bunch of areas, we started to see record high plan cancellations, also known as SARs. This stands for Service Area Reductions. What this means is when a Medicare Advantage plan determines that they no longer want to offer a certain plan in a certain area, and they decide to, frankly, pull the plan out, meaning everybody that's in that area that was on that certain plan would have their plan terminate for the new year. It's typically not announced until the end of September, up until early October, depending on your specific insurance company, that you're notified of this, and then given a time period during open enrollment where you can select a new plan. You also have guaranteed issue rights in many cases as well to pick up a Medicare supplement plan with no health questions and no underwriting. So you have a multitude of different options. We did a video about this recently, so if you want to check out that video, we highly recommend going into the channel and finding it. It's in the most recent videos, okay? But record high plan cancellations. So what does this mean? Well, last open enrollment, we saw over 2 million people have their Medicare Advantage plans terminate, which is the highest in history up until that point. This open enrollment period, we're seeing around the same mark, a little bit around 2 million, give or take, Medicare beneficiaries, 500,000 to 600,000 members. You're seeing small, local, regional insurance companies like UCare in places like Minnesota and Wisconsin pulling out of Medicare Advantage altogether and canceling over 100,000 Medicare beneficiaries, leaving no plans left for anybody to be able to get on that specific insurance company, UCare, right? So we're seeing all of this shifting, all of this disruption. And last open enrollment period, you might have noticed if you're on a Medicare Advantage plan that your benefits might have taken a slight step backwards, at least in one category or another. Not to say this happened with every Medicare Advantage plan in every area, but a whole multitude of them. In fact, the majority of them saw their benefits take a slight step backwards. And you will likely see that this year as well. It could be on your prescription coverage. It could be in your network. It could be in your maximum out of pocket, it going up, meaning you're responsible for more medical copays. It could be that your medical copays are going up. It could be that your over-the-counter item benefit is reduced. It could be that you no longer have a gym membership benefit. It could be that your dental, vision, and hearing benefits are not as lucrative or rich as they once were, amongst other things, right? The Medicare Advantage plans are made up of a whole multitude of different elements that make up the plan. And so when you purchase a Medicare Advantage plan, you're getting everything that comes associated with that plan all neatly wound into one. So you take the good, the bad, the ugly. So for example, if you get a Medicare Advantage plan that you like on the medical benefits, but you don't like on the dental benefits, well, you can't pick and choose that. So you kind of get everything combined with that plan when you pick it up. Now, why is this happening? Why are so many plans canceling and terminating coverage and so many others reducing coverage? Well, the short answer to that is in 2022, the government passed a bill called the Inflation Reduction Act. What this had to do with was a whole multitude of different things associated with our economy, but a whole bunch of it had to do with prescription drug pricing, costs, and Medicare Part D prescription drug coverage in our country. Specifically, it required all Medicare Advantage plans and all Medicare Part D standalone plans, any plan on the Medicare side that provides you prescription drug coverage, also known as Medicare Part D, D for drugs, it was now required starting January 1st of 2025 to give you a mandatory $2,000 maximum out-of-pocket cap. Now, previously, for many, many years, Medicare prescription drug coverage did not have a maximum out-of-pocket. In 2024, they did, but it was a much higher maximum out-of-pocket cap. So this was a huge change in the Medicare market. So Medicare companies, insurance companies that were offering Medicare Advantage plans, had been working off of a formula and a system to determine from a numbers perspective how they could offer Medicare Advantage plans and balance the overall coverage and benefits. So for example, they in the past were offering the medical benefits they were offering, the dental, vision, and hearing, amongst other things, surrounded by knowing roughly what they would have to allocate financially on the prescription drug side of things. And so because of this changed everything. Having a $2,000 maximum out-of-pocket cap required the insurance companies to start being financially responsible for a huge amount more on the prescription drug portion of the plan than they ever had to before. To kind of prevent profits from being lost, the insurance companies have to maneuver benefits. And some plans just are not viable anymore in this new model. That's why you're seeing plan cancellations. Now, Medicare Advantage plans always, typically, historically, go through a little bit of shifting during open enrollment period, but we're seeing more of those shifts last open enrollment and now this open enrollment than we've ever seen before, and this is the reason why. The Inflation Reduction Act has caused a tremendous domino effect in having other benefits cut. Now, it is good for some people that are spending a lot of money on prescription drug costs. For a lot of people that were spending in the old system over $2,000 a year in prescription drug costs, it was good for those individuals because it saved them money on their prescription drug costs. But for a lot of others that maybe don't take as many prescriptions or have lower cost prescriptions or mostly take generics, they probably will end up overall with a worse plan option than what they had before. So it was kind of like, in a way, you could think of it from the perspective to that Medicare Advantage plans are having to cut off their nose to spite their face, right? And that's kind of what this legislation is doing. Now, what is our recommendation at Everything Senior Insurance this open enrollment period? Well, the Medicare open enrollment season is October 15th through December 7th. Starting October 1st, all plans are required to put out their plan benefits for the next year to the public. So you should be seeing this after October 1st or listening to this. And so you should be able to know what your plan benefits are going to look like. You would be getting an annual notice of change document from your insurance company by now, and that spells out the changes from this year in 2025 to next year, 2026. We highly suggest that if you feel like your plan is changing dramatically, and even more so if you find out that your plan is canceling your benefits or terminating your benefits, having it revisited and making sure that you're going to be on the best plan option you can be for 2026. My organization can help out with this. Like I said, we're licensed in 46 states and we work with a whole multitude of insurance companies. We're extremely skilled at navigating through the options and finding the best ones based on your needs and preferences at Everything Senior Insurance. I work with an amazing team that surrounds me, and we have a lot of great, amazing licensed agents that don't cost you a penny to work with. And we also offer lifetime customer service to anybody that is a client with us. We have a great reputation, great 5-star reviews, so give us a call this open enrollment period, 801-255-5340. Again, 801-255-5340. You can also find all of our contact information in the description of this video. What else do you need to know when it comes to Medicare Advantage plans? Are they still viable? Are they still good plans? Well, my answer is yes, I think for a lot of people that they are. I think everybody has different needs and preferences, and we're also very pro Medigap or Medicare supplement plans in our office for the right person. It kind of depends on where you are and what's available to you, but what we're seeing right now is a Medicare Advantage market reset. And my expertise has told me, and talking to other people that I know in the Medicare space, everybody kind of agrees that this will be a multi-year shift for the plans to navigate and be able to reset and put out what's going to be common and traditional for coverage surrounding this new prescription drug model. So we might see a lot of changes on your plans, more than normal, this open enrollment period, just like we did last. You might see a lot of plan cancellations this open enrollment period, just like we did last. And it's very possible that we see it again next open enrollment period as well. Eventually, this will calm down and it will reset and get back to normal in a sense, in terms of not being as much changes as we're seeing. But right now, we're kind of in the thick of that. And we at Everything Senior Insurance are here to help and make sure that you know and you understand everything that you need to know to make a good plan decision for 2026. We hope you found this video helpful. If you did, please do us a favor. Smash the like button for the YouTube algorithm. It will help more people on Medicare find this video who desperately need to hear this information. Also, make sure to subscribe. We put out consistent videos to help you out and navigate your Medicare options for free. No obligation of any kind other than just subscribing. And comment your thoughts down below. What do you think about the Inflation Reduction Act, these Medicare Advantage changes? Are they good? Are they bad? Are you indifferent? Do you hate Medicare Advantage plans? Do you love Medicare Advantage plans? What are your thoughts? We'd love to have a dialogue with you. And until next time, thanks so much for watching, everybody. Happy Medicaring and happy open enrollment period.